I'm Matthew Moody. I work for the Crisis Response Network, and I'm manager of operations for the contact center. We always encourage people to call us and not to second guess themselves. Let our specialists determine what the right course of action is and figure out how we can help them. So that can be anything from just, providing supportive listening, determining if police or fire are needed, if there's a safety issue or a medical emergency, and then also see if a mobile team is the best action.
My name is Brian, and I'm the Director of Northern Arizona Crisis Services for Terros Health. So mobile crisis is a little bit like 911, but for mental health emergencies. So we go out and see people in times of high need to talk to them, figure out what's going on, and really connect them to resources in their communities that will help them. And one of the really great things about our services is that it's a free service, so we can see anyone, whether they have insurance or not, and it's not going to cost them anything.
When someone calls CRN, we're going to triage the call very quickly. A specialist or a supervisor is going to answer almost immediately. We're going to do a risk assessment and make sure that they're safe, and then start to get an idea of what's going on. Do resources help? Is it something we can resolve over the phone? Do they need supportive listening? Can we help them de-escalate over the phone? Like we can help people resolve panic attacks pretty effectively. If there's a safety issue, we'll get the police or the firefighters involved because they're going to be able to resolve some issues like safety or a medical emergency. Frequently, when first responders go out, they're also going to ask for a mobile team if the scene is secure, and they could benefit from that for a behavioral health emergency. Our crisis line is available 24/7, 365 days a year. When someone is going to request a mobile team, we're always going to try to resolve the call over the phone to the best of our ability. We'll send a mobile team out if we feel that the person would benefit more from a face-to-face interaction, or that we're not able to resolve it over the phone. A lot of the most frequent reasons that we would send a team out to somebody is having suicidal thoughts, feeling like they need to self-harm, like cutting or burning themselves, psychosis, substance abuse issues, and then really, intense levels of anxiety or depression.
So we can send crisis specialists pretty much anywhere in the community. So that can be people's houses, schools, public places. So in my experience, we've seen such a range of different things. When we get on scene, we really try to get to know the individual and what's going on with them, as well as what they do have in their life as far as social supports and skills and other resources. So we try to explore those and really build on them and give them a sense of hope going forward. And that includes giving them a specific plan of some steps to take in the next few days to help them feel better. After we've left the person with a specific sort of plan of what to do next, we'll follow up with them again and make sure that they're still doing all right. So it's a really great service.